Hi, my name is Ann Martin. I'm the project manager for the multi-patient simulation study that examines patient safety. I'm going to take you through a few tips before you start the simulation process. First of all, probably the best idea is to attempt the simulation prior to actually running the scenario with students, just so you can work out any kinks and see, areas that you might need improvement on, any supplies that might be missing, equipment that might not be working. So that's always a good thought. One idea might be to have students come in during their post-op clinical conferences or post-clinical conferences to just run through the scenario for you, just to see what's missing and so forth. Another tip is, one suggestion is that you really do need 3 faculty to run the scenarios. You'll need one faculty who is going to observe the students and how they conduct the simulation. You'll need one faculty to be the phone person, and they'll be able to complete some of the interruptions and so forth. And then an additional faculty is kind of handy to have to help run for any additional help you might need. The third tip is to be sure that you are aware of the pathophysiology that's going on in the simulations. So just to review that kind of information ahead of time, because students will often have specific questions about how to handle that particular situation, and that comes up in debriefing sometimes. So just be thinking about that ahead of time. Sometimes another tip is students will often go to places that you'd never imagined or ask for tests, or to speak with a particular person that you'd never planned on. And it's always a good idea just to have that in the back of your mind. For example, a student might ask for a physician to get a chest x-ray. The unit secretary can say, well, we're ordering that or that piece of equipment or that particular lab study, and it's coming, or the RT is on their way, that kind of thing. And it's, pretty realistic that that particular person never arrives during your 20-minute simulation. So just keep that in mind too. We try to be as realistic as we possibly can during the simulations. So if, for example, in the one simulation, a student might check a blood sugar, give apple juice, and need to recheck it in 20 minutes, we want to actually wait the 20 minutes. Or if they're actually drawing the blood sugar, we want the student to actually get all the equipment that's required for the blood sugar draw, and to actually go through the motions. And it depends. If you have a high-fidelity Manikin, you can maybe actually draw some blood off. If you have a low-fidelity Manikin, you may not be able to, but the student would go through the process of doing that. I've also included 2 tapes with the simulations, a coughing tape and a confused tape. And these are for use when you have the low-fidelity Manikins. It's real easy just to slip them into a small tape recorder and play it. I just tucked it in underneath the pillow, so it kept it real simple. The first 7 minutes is blank, so there will be no dialogue whatsoever. At 7 minutes, when that particular patient goes bad, that is when the tape will kick in and you will hear those voices. The only other tip I have is to make sure that you have 2 copies of your MAR, or medication administration records, for your 2 different nursing students who will be conducting the simulation, so that they both have copies of that information. And that's the end of the tips.